Hi everyone, I'm Dr. Natalie from Countryside Vet Service, and today I wanted to talk to you a little bit about how important your pet's dental health is. I think sometimes it's an underestimated part of your pet's overall health, but a really important part. One being, as teeth decay over time and potentially are lost over time, can affect your pet's ability to eat and maintain their body condition. But also, infected and abscessed teeth can lead to systemic infections, even so much as going to affect the valves of your dog's heart. So we want to make sure we're staying on top of dental health and making sure that we're not having pets with infected teeth. Probably most common pets that we're going to see for this issue are going to be your kind of smaller breed dogs. Tend to have more issues with dental disease just because they've got the same amount of teeth in a smaller space. So there's more nooks and crannies for bacteria and plaque to build up in. But any pet can be affected by dental disease. And so it's an important thing to have your veterinarian check at their annual vaccine appointment, or if you're having a physical concern. So if your pet is maybe not eating as well as they used to, or maybe wanting to eat on one side over the other, maybe not wanting to eat hard things and leaning more towards canned food options, or if they're at all crying out or wincing in pain when they're eating or drinking, could all be signs of potential dental issues. Another one that we'll sometimes see is swelling along the muzzle or under the eyes. That can be a sign of a tooth root abscess that might need some attention. So what happens when a veterinarian performs a dental on your pet? Well, it's very similar to what happens when you go to the dentist, except for most dogs or cats are not going to let us get a very thorough look in their mouth while they're awake. So they are sedated for these procedures, which is just allowing us to get as good of a look as we can in the mouth. And then also if any teeth are having an issue where they need to be extracted, that can happen at the same time. So the first thing that we're going to do is use an ultrasonic scaler. This is going to take the plaque and tartar off of those teeth so we can get a good look at the enamel underneath. This allows us to use our elevators to examine the teeth along the gum line and make sure that there's no pockets or root exposure that could be causing pain for your pet. After the cleaning and evaluation of the teeth are done, if there are any teeth that need to be extracted, that will happen at that time. Sometimes if they're multi-rooted teeth, they'll need to be drilled in half to allow for removal of the roots, and so we have the ability to do that. Sometimes we've got to use our big pullers to get a good grip on the teeth and get them out that way. After the teeth that are affected are removed and everything is closed up, then we will go through and polish the remaining teeth to remove any grooves or anything that our scaler might have left behind to prevent further plaque buildup, and also help with some stinky breath as well. So again, very important to get your pet's teeth looked at, and if dental procedures are needed, to get them done in a timely manner. Thank you. Have a good day.